of this chapter is really on the obsessive compulsive disorder, which is OCD. Now, take note, this is not the same as OCPD. That acronym stands for Obsessive Compulsive Personality Disorder. And that belongs to a different group of disorders, the personality disorders, which we will discuss toward the end of the semester. So for now, let's focus on Obsessive Compulsive Disorder, or OCD. So if you look at the Diagnostic and Statistical Manual of Mental Disorders, version 5, fifth version, you will see the clinical criteria or the clinical description for OCD. So for you to be diagnosed, you should have obsessions or compulsions or both. So take note, more often than not, you're gonna see someone both with obsessions and compulsions, but there are also cases where a person only has obsessions, meaning persistent thoughts that he or she cannot get out of his or her mind and which bother him so much and which take up so much of the person's time and energy. Okay? Or it's possible that the person just has certain compulsions or certain habits and rituals that he finds difficult to not follow and which affects his or her daily living. So these obsessions and compulsions should be recurrent and persistent, just like the definition that we had later. And in terms of the obsessions, there should have been attempts to ignore or suppress or neutralize them, and yet they still emerge. Okay, so there are attempts to think of other things, attempts to stop thinking about or imagining or visualizing certain things, and yet they are still there. As for the compulsions, the behaviors are applied rigidly. Okay, so they are done to the exact specification that the person believes should be done. Otherwise, the person feels very anxious, very bothered. And usually, when there are compulsions, they are meant to neutralize or control the obsessions. Okay, now they should be clearly excessive. So, for example, now that there is COVID, it's only very natural for us to practice hand washing throughout the day, right? Especially like if we touch objects, if we touch other people, if we've interacted outside our home. So we could probably do that like when we get home, you wash the 20 counts because that's the recommended by I think the DOH or the World Health Organization. 20 counts, or like saying happy birthday while you wash your hands, no? But let's say you've been in your room the whole day. You haven't touched anything other than the objects in your room, which have also not been exposed to anyone. And yet, every few seconds, you have the urge to keep washing your hands. And when you wash your hands, you end up making sores, diba? And little cuts on your hands because you wash them so vigorously that your skin gets damaged. So you end up actually with wounds, which could potentially cause you greater danger, okay, than the actual. Hopefully, you're supposed to protect yourself, and yet you're putting yourself in harm's way because of the bruises and possibly the cuts on your skin. Okay. Another thing is that it should be time consuming. So, meaning the definition being that the behavior or the obsession occupies more than 1 hour of your day, which is an unnecessary amount of time. So, for example, if you end up always getting late for work, okay, then if you have to clean something for more than 1 hour when you can actually accomplish that in a few minutes, that may be problematic. Okay? Or if, for example, you end up obsessing or thinking about something for a very long time, such that it occupies a lot of time in your day, then that might be a sign. Okay? So if you think about the specifiers, it's observed in terms of the amount of insight, good, poor, or absent. So when you say good, you know that the obsessions, the thoughts, are actually most probably not true, and the threat is probably not there. So for example, there are people who think that uh, if they leave the house without properly counting the tiles on the floor, they are gonna die by an accident. Okay, so that's a pretty weird sounding obsession, but these things happen. So you think, I'm gonna die. I'm gonna die if I leave the house. So what they do is their compulsion is that when they leave their house, they have to start counting the tiles. Now, if you have good insight, you know that that's probably not gonna happen. That when you leave your house, you're gonna die. Okay, that's not reasonable, and that your counting of tiles is most probably not going to affect your death or survival, and yet it's just that you have to keep doing it. Okay. However, when you have poor insight, you are more you're more doubtful. You kind of think that, oh, maybe it is possible. Maybe I might die for some reason if I don't do this. So you stick to the ritual. However, worse than the first two would be absent insight, when you are absolutely convinced and scared and anxious because you really know that if you step out of your house and you don't perform the ritual, you are actually gonna die. So you're gonna try to ease that by faithfully performing your ritual. Okay? Now, you should note that usually kids with OCD have often been diagnosed with a tic disorder before, commonly from Tourette's disorder, Tourette syndrome. Okay, so in Tourette syndrome, they have tics. So sometimes they like behave in certain ways, seemingly uncontrollably. So they sometimes hit their heads or hit their face, or sometimes they blurt out certain words that doesn't seem to be under their control. So sometimes they have small seizure-like behaviors. So what we know is that almost half, so not really half, but almost half, 40% of kids diagnosed with OCD used to have a tic disorder. And sometimes some scientists are hypothesizing that it's possible that a tic symptom is actually a form of compulsion, okay, to attempt to ease or control or stop an obsession. Okay? Oops, sorry.